We'll call the Human Service Committee to order. Everyone is here, so I don't think it's necessary to say here. Everyone is here, and we have a new YIG student, Jessica Camacho. Welcome. Congratulations. And there's one other student, but she's not here.
Ruby's sick tonight, but Ruby is also assigned to this committee, so she'll be here the next time.
Okay, all right. Ruby, what's her last name?
What's Ruby's last name?
This is PTA.
Gutierrez, it's
They're
hyphenated,
hyphenated.
and I'm terrible with names.
It's hyphenated and long.
Yeah, it's, please, because I,
You brought it up.
yeah, I was gonna say.
Oh, I have it right here. Ruby,
Dorado,
Okay,
and I don't know how. Double R.
so where do you attend school?
I go to Lakeview.
Oh, Lakeview Tech. Okay, very good. Now that's a school that just moved, right? Aren't you?
Yeah, they moved like by Uptown on the old like Chrysler.
Right, right.
Or plant. Yeah,
And you're in what grade?
I'm a sophomore.
Sophomore. Okay. Again, welcome.
Thank you.
Thanks for being here.
You're a sophomore now, you're a rising junior.
Yeah.
Right, okay. I was
All right.
like, you're not, you can't be a sophomore. I got you, okay,
At least
sorry.
for another week or so, right? Okay.
Sorry.
All right, are there any citizen comments? Any citizen comments? No one's coming to front, so citizen comments are closed. All right, I don't have any particular comments myself. Do any of the committee members have anything that they would like to say? Any updates or anything? Yes, Julia.
I would just like to remind everyone that the Health Thrive survey is out. Please make sure that you go and do that. Please pass it along. Whether that is on your social media or whatever, talk about it. Send it through churches, whatever. We need a whole wide variety of people to be taking this survey so that we can get the most accurate information possible. Thank you.
Thank you. Anybody else? No? Okay, approval of the minutes from April 2nd, our last month. Do I have any questions on the minutes? Otherwise, do I have a motion to approve?
Motion to approve.
Okay, we have a motion on the floor by Supervisor Poole, a second by Supervisor Nez. All those in favor say aye. Aye. Opposed? Okay, motion carries. Minutes are approved. Okay, first we have a resolution to approve the appointment of Kenny Harper to serve on the Kenosha Racine Community Action Agency. Mr. Harper is here. How you doing, Kenny? How's it going?
Well, good evening, everybody. Doing well as usual.
Yeah. And did everyone get a chance to look at his bio and all the other information that was submitted? Any questions for Mr. Harper? Is that a question?
No. Yeah, no, we're all
Okay.
good, I'm good.
Any questions? No? Okay, we have a motion on the floor by Supervisor Robinson, a second by Supervisor Brown. All those in favor, say aye. Aye. Opposed? Motion carries. Congratulations.
Thank you.
Next, we'll be
Thank you.
sent to the county board.
Okay.
Yeah.
Thank you, guys.
Thank you.
Thanks, Ken.
Thanks for coming.
That's
Want to separate the youth and governance vote from our vote?
Oh, yes.
I
Sorry.
usually like this, but I don't really need to.
Oh, yeah.
Explain it.
Yeah, that's
Okay.
I explained it once, but
is
yeah.
the not this county board meeting tonight.
Correct.
For the
Next
next
one.
one.
Right.
Yes,
Oh,
yes.
2 weeks.
Yeah, it won't be on the
2 weeks.
agenda for tonight. It'll be in 2 weeks.
Okay.
Yeah, and so you're welcome to come. The final vote will be then,
Okay.
county board vote.
All right.
Jessica, I'm sorry, I passed you up. How do you vote?
Yay.
Okay, all right, for the record. Let's see. You are good, sir.
All right. Thank you, guys.
Thank
Thank you. Good luck.
Next, we have a resolution to approve the appointment of Supervisor Andres Gama to serve on the Kenosha County Human Services Board. Okay, did everyone look at his resume?
May I just add a comment?
Sure.
So the Human Service Board requires 3 county board supervisors. So we have Supervisor Gashke as part of that. One of the supervisors has to be a member of the Human Service Committee, which is the next nomination, and Supervisor Gama would fill that 3rd supervisor slot.
Got it. Perfect. All right, any questions for Supervisor Gama?
No,
Yes,
I do
Supervisor
for John. So who are the ones that came off or that we need? to
Oh.
replace?
John O'Day.
Oh, so it's been a while?
Oh, it's been a while.
Okay.
Wow.
Because there's no one immediately coming on. We're just filling vacancies.
Correct.
Okay, thank you. Thank you.
All right.
Thank you.
Any other questions? No?
I move Andres Gama to be
Okay.
put on
We have
the,
a motion by Supervisor Nordigian. We have a second by, okay, Supervisor Kirby. All those in favor, say aye.
Aye.
Opposed, nay. Jessica, how do you vote?
Yes.
Yes, I should be asking you first. I'll get there.
you get the first votes.
Maybe the next one I'll be over.
We're just practicing.
All right, very good.
Sweet.
All right, you're good.
Good.
And you'll be voted on, 2 weeks.
Yeah.
All right. The last resolution, is to approve the appointment of Supervisor Sarah Kirby to serve on the Kenosha County Human Services Board.
Do you like me to move to the hot seat?
I think you're okay.
We can put you in the hot seat right there.
Move to the hot seat, you might seriously get a question.
Oh, okay.
Any, comments, questions for Supervisor Kirby?
Why did you volunteer for this?
Because I want to help my community. I'm very grateful for everybody who helped me get to where I am today. And if I can help somebody else that was in my position, then that would be wonderful.
Good answer.
Move Sarah Kirby be put on the board.
Motion by Supervisor Nerdigian, a second by Supervisor Robinson. Yeek. You had to think about that. Sometimes the charm. How do you vote?
Yes. Is it yes or like yay
You
or?
could say
Either one.
Or I.
Thumbs up, you
Yeah.
know.
Yeah.
whatever you have.
Any kind of positive affirmation.
Yeah. The board, how do you vote?
Aye.
Aye. Opposed? Motion carries. Sarah, you are confirmed. You will also be before the
Yes.
county board in 2 weeks. Okay, all right. Tonight, we have a presentation by the Human Services, we're gonna hear the Human Services Annual Report for 2024. You know, when we do our budgets in September, October, when it's confirmed in early November, that last quarter is obviously not completed, so it's good to hear the year-end report now. And so that's what we're gonna hear, so.
So this is hot off the press. I'm going to introduce Katie Hanks, who's appeared in front of you before. She's our quality analyst for Human Services, and she helped put together the report. So I have her walk through page by page and read it to you.
Oh, please.
Well, I'm just.
Not doing that.
I promise.
You're just really full of beans tonight.
He likes to make me nervous.
Well, you are in the hot seat according to Sarah.
Yes.
You
I
might get some questions.
Questions are good. So this is the Kenosha County Human Services 2024 annual report. And the annual report does go over all of human services. So we have sectioned out each of the divisions. And then within those divisions, we do a small overview and then highlight some of their bigger programs or the more of the services that are being provided. Now, when I say that this is not all encompassing of everything everybody in all the divisions for human services does. So for more information on that, we have most of the annual reports are all posted on the division specific websites. You can see division specific dashboards and the human services dashboard, which are all posted on the website. So more specific or more detailed information would all be there. Okay, so we start off with an overview of human services. We talked about our mission. And then the thing I wanted to highlight to you is that we had 403,399 calls come into the human services building that were addressing some service or some question in the all of human services. And then in individual divisions, we do go into some detail on some other divisions that have calls specific to that.
Can we increase the size?
Yes, absolutely, I can.
So we can actually read it? Okay.
Yeah.
Yay.
Here we go. So there we go. So that's the kind of just the overview for human services. And then we go into the Division of Aging and Disability Services, which has a lot of services that are provided to, it's supposed to be a one-stop shop for older people, people with disabilities, their families, things like that. So first we talk about our Adult Protective Services Unit, or APS. And they investigate allegations of abuse, neglect, self-neglect, financial neglect, all kinds of things. And in 2024, we opened, which also means served, that's the same here, 728 cases for adult protective services in 2024. Questions so far?
How's that compared to last year?
That's a great question.
It's up.
20%.
Our monthly dashboards highlight the difference from
The comparison.
month to month, so you look at 24 versus where we're at in 25, so that is more specific than we got into in this.
Right.
Next up, we talk about transportation, big service that aging provides. And we had 22,000, just over 22,000 caravan, one-way trips. There's regional transportation, volunteer, and then the Westosha or Western County Transit.
And I want to jump in a little bit on transportation to update you on something that's kind of brewing as we speak. So our caravan service, which is also called our paratransit service, is a service that's required for the city to provide under the Americans with Disabilities Act. They have to provide accommodated transportation from 3/4 of a mile from any bus route. What the county subsidizes is the paratransit for those who are more than 3/4 of a mile from that bus route. We have had a combined contract with the city for Kenosha Achievement Center to provide that caravan service for both the city and the county. That way it was seamless. It didn't matter if you were, 1/4 of a mile or 3/4 of a mile. It just was the same. Everybody knew who the provider was. Unfortunately, Kenosha Achievement Center gave notice to both the city and the county that they're ending their service with us by the end of June. The reason for that is they are taking a substantial loss on the city side of it. Not on the county side. And the reason for that is the county side, we pay them per trip, and the per trips are a lot easier when it's over 3/4 of a mile than when it's under 3/4 of a mile. For the Americans with Disabilities Act, the city is required to provide paratransit services at the time that the city bus runs, regardless of whether there's a trip or not. And the way that the city reimburses KAC is by trip. So there could be, hours in the day where there's no trip, and caravan KAC is covering that cost. So they have taken a substantial loss. So they have given us a notice that they're going to end services. We are in the process of waiting to hear from the city on what the city plans to do. Again, I don't know if the city is going to negotiate with KAC to make them whole and try to keep the service. Our plan B is KAC will contract with the county to provide our service 3/4 of a mile and over the city bus route moving forward, because we have been, able to provide them with the kind of revenue that they're able to make ends meet. So it's kind of up in the air at this point in time. We're waiting to see what the city does first. For our constituents' sake, we would love to keep the service the way it is. I'll be honest with you, fiscally, it would be more fiscally prudent for us to break away from the city, because we pay about 30% of the cost, the total cost of caravan of the paratransit services, and we only provide 10 to 15% of the rides. So this is one of those balance between, it would be a real big hardship for a lot of our community to have to call two different numbers, and it would be incredibly confusing. We would really not want to have to do that, but this might force us in an opportunity to be able to provide some different type of services, because we probably have some excess money. The money that funds this through the county, it's about $150,000 that we provide. 120 of that is through our 8521 grant with the state of Wisconsin, which is our Department of Transportation grant. And then there's $30,000 worth of levy. So we could save levy, we could start a different service. I think the options are open to us at this point, but again, we really want to know what the city does, because for the sake of the people that ride that, we would really like it to stay consistent with with, you know, having one provider. So we'll certainly keep everybody updated, but we wanted to make sure that that was brought up today, just in case you hear something out in the community about this notice.
It'd be nice to know, especially before the budgeting process.
yeah.
And-
Well, we're gonna have to know.
Yeah, right, exactly.
Right, we're gonna have to have some decisions made.
Yes, Supervisor Robbins.
I mean, if they've already given notice to the city, that means that we've got constituents who have doctor's appointments that they're not going to be able to use. Has the public been notified?
No, it's actually, we just received the notice on Friday. So no one has notified. I do know that the city met with KAC today. I don't know what that meeting, we're kind of waiting to hear from the city what their move is going to be before we decide, you know, how we're going to move forward.
Right, okay, thank you.
Sure.
Supervisor Brown?
Couldn't you, city and county, what about Pleasant Prairie and?
So we covered that under
Because we
paratransit.
don't have buses, because it's
Correct.
the bus service, is that what's considered city?
Yeah, yes, anything that is 3/4 of a mile from a bus route, the city has to provide. Anything after that, they do not, which is where we step in and we provide it to Summers.
Yeah.
So we have, Kenosha County is lucky, we actually have a border to border coverage between our link service out in Western and then our paratransit service through KAC in the city. So anyone with a disability or fits that aging mark is able to get any type of accommodated ride.
Thank you.
Supervisor Nordine?
Thank you, Chairman. That's what I was gonna bring up. What's the Western? I know it's not the same. What's
Link,
it called?
yeah.
It's Link.
Yeah,
Okay.
it's different, but those are accommodated buses, so
Yeah,
they're
That's
accessible
fine.
buses.
I knew
So
it
a
wasn't,
person can-
city.
Yep,
bus
yep,
service.
yep.
I
And they
couldn't
just
remember
can
thinking-
call and get
Yeah,
that type of door-to-door service
Yeah,
with
that's
Link as
fine.
well.
Thank
Yep,
you. I just couldn't remember.
sure.
Thank
Yeah,
you.
and that's different funding and that's not at
Yeah,
risk with
right.
any of this.
Supervisor Poole?
Yeah, was it, federal funding that was discontinued, I mean?
No, this is simply a decision made by KAC because of the loss of their revenue to them on this contract, not necessarily because the city lost any money. It's just been, they've incurred higher costs than what the contract has been able to meet.
Give them 30 days notice.
They, you know, again, I feel for KAC, they're a nonprofit, to take a substantial loss, and I think we saw it was somewhere between $300,000 and $400,000 they were losing on this contract. They can't. It won't, you can't survive as a nonprofit losing that kind of money, so. It's a hard position for them to be in. I know that Chris Weicker, the CEO, felt really bad. She came in and met with John last week, and she did not want to be in this position, but unfortunately for the sake of her business, they have to somehow make ends meet. So we'll certainly keep everybody posted and as this progresses, but you know, we'll know something by the end of the month because we'll have to. You're
Thank
welcome.
you.
Right. Moving on, we talked about the Aging and Disability Resource Center, which serves a lot of individuals, 60 plus and adults with disabilities. We're connecting them to resources and other support. The main things I'm going to pull your attention to is some of the bigger numbers. So when you saw that those numbers, the calls into human services was 400,000, 28,900 of those are just for aging and disability services. So that's the calls that they took and then transferred on. So some of those numbers are included into benefit specialist referrals and other services as they refer them those calls on. The other big number is our marketing. That includes that's the 18,000. That's all of ads, public service announcements, articles that we post in the newspaper, things like that. So that's all of the Aging and Disability Resource Center. Questions? Yes.
I do. On the marketing, so are you able to measure the effectiveness of each style of marketing? And the reason I bring that up is it's a lot of money to spend and hopefully you're getting, you know, as much out there as you can.
Aging and disability contract with the state of Wisconsin, they do provide us dollars to provide the marketing.
Mhm.
We've done some studies. We've had some market studies done. We've used some local companies. We have found that the best marketing to our target audience has been the newspaper. A lot of our seniors read the newspaper. The rest is social media for our folks that are under 60 who have disabilities. So that's why you see the article number is so high, because we do post a lot of articles across a lot of different variety of media outlets. It is hard to judge the effectiveness. We do a survey where we ask people, how did you find out about us? How did you hear about us?
It's low turnout.
We get low turnout and most of the time we hear from somebody else. And
So-
so,
Can the articles that are online or on social media have, you know, whatever the terminology is for when someone sees it, know that someone has seen it? I know you don't know who it is,
I know
what their demographic is.
I know the website does that. I'm
Well,
not
you know,
sure how we get that information from like the.
I'm just a question. I don't know.
Good thing. I'm gonna have to go find out about that and get back to you because I really
Okay.
don't know. So
Okay.
I'll check that out because that's a good thing to know.
Yeah, yeah, thank you.
And more data to collect.
Data girl.
Turn the data into information.
That's right. All right, so the last section of aging and disability is our community living, which is a lot of our other services and supports, which includes friendly visitor, housekeeping, and a lot of our nutrition information. So Meals on Wheels, we home delivered 49,963 meals. So along with the other types of services there too. Questions on aging and disability overall?
Meals on Wheels has increased too, hasn't it?
Yeah, I believe it has, yes.
Yeah.
Mhm. All right, moving on, we get into behavioral health services in 2024. And we're talking about any of those residents that, you know, are facing life's challenges with behavioral health needs. And so we broke that down into some of our programs, and we started off with our case management programs. We have the community support program, which is serving our more intense mental health needs. And we served 132 participants and admitted 30 participants into the program in 2024. And then we have our comprehensive community services. Now, this is the adult services only in behavioral health. You'll see the juvenile services when we get into the Division of Children and Family Services, because that's split out. So this is providing a wide array of services and really focusing on that recovery focus and trying to get people to live independent in their own homes and things like that. So for CCS, we served 254 adult consumers in 2024 and admitted 95, which is a significant increase over previous years. It's just been ticking up every year after year.
Isn't that due to the aging population?
I think it is partially due to that. It's also partially due to people becoming more willing to come out and ask for services and help. And we've really focused on increasing our adult services. The juvenile services have been really robust since 2010. And it's been a bigger side of the program. And we really took on efforts to advertise the adult CCS services a lot more. All right, then we get into comprehensive alcohol and drug treatment program, served 82 participants and admitted 39. Treatment court served 22 people. And then we get, before I move on to crisis, then that's the kind of the end of case management. Any questions on the case management part for behavioral health?
Yes, the CADTP. Instances of participants received medication for opioid use disorder. What?
So this is our the Vivitrol injections.
Oh, I know what the medication is.
Okay.
I'm wondering where these people are.
Well,
how are they accessing the services?
PSG is our contracted service provider for the program. And so that answer your question?
Yeah.
Okay.
Yeah. So it's outpatient.
Yes. Yes.
I was just answering Mark's question. That's a learning question.
Well, thank you. All right. Anything else on the case management stuff?
Then I'm sorry. Yes, I do have one more question. I'm sorry. When you show two different numbers, participants served and new participants, is the new participants part of the participants served, or is it?
It is.
Okay, thank you.
It is, yes. In all of these charts.
Yes.
Yeah. So we wanted to pull out not just, this is a good question because I want to talk about it over.
No. Yeah.
So we wanted to really give you a picture of, okay, these are the new people that came in this year, but we also don't want to leave out all those people that we continue to serve year over year and how big the program continues to expand and maintain. So
thank you.
Yes. going 3 times. Okay. Crisis services, crisis intervention is contracted through, Kenosha Human Development Services. We had 17,000 contacts. Some were initial crisis events, a lot of follow-up contact, really connecting to community resources as part of crisis services. And then the care center, which had 577 admissions, and those total days of service equaled out to 3,680 days of service. Now, of course, that's duplicated. But, so. Then court services, I lost my place. Court services. Court liaisons that provide additional linkage and follow-up for residents that are placed on Chapter 51 orders. We served 122 commitment orders and 90-day settlement agreements, so served 244 consumers through that court services program. And then case management, so crisis case management, where we continue to follow people who had an initial crisis event for up to 6 months with some short-term case management, and 170 people were served that way. Any questions on crisis? And we get into the placement information. So we had 286 admissions into psychiatric hospitals. And we have some charts on there about location, private facilities versus state institutes. And then residential group home placements. There's some information about that. We've served 49 participants through residential group home placements and funded a total of 13,555 days of service. Questions on that or anything else with behavioral health?
Yeah. Supervisor Brown.
What would be a private facility for psychiatric hospitalization? Where would somebody go?
Like Granite Hill, which is the private psychiatric hospital in Milwaukee.
Got it.
That would be considered one. Even like Aurora Psych is considered a private hospital.
Okay. Thank you.
Supervisor Poole.
Thank you, Mr. Chair. The first time I was on Human Services Committee, we got to take a tour of the care center when it first opened. Is there a possibility we could do that again?
I say of course, but
Yeah, we could certainly check with kids and make an arrangement for that if you'd like to do that. Sure. A field
I
trip.
thought it was very informative.
Yes. Good idea.
In fact, we toured a lot of the places that Kenosha funds, you know.
Right. Let us know when the availability
Hey,
is.
you can go with the youth and governments one. wouldn't it?
Yeah. The bus tour.
I've been. This is for the rest of you.
Go ahead.
okay. Then we move on to Brookside and Willowbrook. Pretty self-explanatory for the most part. I think everyone is pretty familiar. We did have 386 new admissions in Brookside and carried an average daily census for the year of 136.5. Willowbrook, we had 3 respite admissions in 2024. We had 13 permanent admissions in 2024, and then a total residents served throughout the year is 32. So not a lot of movement.
What's the total number of
24.
for Brookside?
Oh.
24.
The total number of
Beds.
beds,
154 beds.
150.
So keep in mind, in 2024, we budgeted a census of 128.
So we're above budget.
And then this year, I believe we budgeted at the 136 number. As of today, we had 148 in.
Oh, good. Okay.
So things are going.
Start to come up.
But long sense, yeah.
Yeah.
I have a feeling our aging and disability will get more services.
You do the trouble.
For services.
Math on the floor.
Go ahead.
Any other questions about Brookside or Willowbrook? Then we can move on to Children and Family Services. So we've got our overview of what the division does, and then our first section talks about our Child Protective Services Unit, or CPS, that works with our access unit and investigates child abuse and neglect. We received 2,986 child protective reports, and we screened in 691 of those. That includes some drug affected infant service reports. I believe there were 13 in 2024, if I remember correctly. So that's that. And then for our ongoing services unit, our total ongoing families served was 270 and the families that were served. So those 200 new ones were 75. So continuing to serve some of those existing ones. Youth justice. Our youth justice families, we served 306 in 2024, with 153 of those being youth. And then we have our court ordered and our voluntary services. There's a slew of services that we provide, court ordered services and voluntary, and we contract a lot of those services out with various providers. We highlighted a few of those, which was Prevention Services Network and Resource Center. They provide some case management along with the Resource Center. The Family Resource Center served 552 people in various events and the walk-in and available that way. We also have the Birth to Three program, which is contracted through KAC, Kenosha Treatment Center. They served 314 and admitted 176 children into the program. And that's just like that sounds like from children from birth to 3 who have disabilities. And then we have the comprehensive community services on the juvenile side of services, which again is that recovery focused intensive case management with other services and support to wrap around the family to ensure success and recovery. And we served 423 juveniles and admitted 137 juveniles into the program in 2024. And then our Children's Long-Term Support Program, which is contracted both through PSG and Kenosha Human Development Services. We served 1,050 children, some of which are a duplicated number of our CCS numbers, as some children can be dually enrolled in CCS and CLTS. CLTS is really for those physical disabilities and some of those other long-term things. So can serve both. There's no waiting list for CLTS services. So we keep serving, and long term by nature, there's not a lot as much turnover in this program, so it expands more than you'll see that number stay stagnated. And we did admit 271 consumers, children with long-term care needs, into the CLTS program in 2024. And then we have our kinship program. We had 90 court-ordered kinship and 169 voluntary kinship. I believe that is the end of DCFS. Questions?
Kinship? I know what it means generally, but how is it referred to here?
So this is the program that supports any child who lives outside of their home with a caregiver. So there's that support. It could be temporary, it can be long-term.
Is that considering foster care then too?
No.
No, so it's not really any child.
Yeah.
Yes, you're right.
It's with a family member or.
Right now,
It-
there's
yeah.
also legislation that just passed called like kin, so they're expanding that definition. So if you have a neighbor who's been actively involved in that child or children's life, they could potentially take over that parenting role while you work with the.
Just like Lilo and Stitch.
Looks like. Looks like. Keep with some.
There is also non-relative kinship placements that are allowable under the code.
Are these numbers pretty consistent, or is that coming down, going up?
I think it's been consistent.
I think it's been consistent. I think we'll see some increase now with that like kin.
Yeah.
Legislation, once they roll out all those rules.
Right,
So we could see a pickup on that.
thank you.
Questions back, yeah.
Oh,
Back.
go ahead.
Do you have a-
keep track of denied requests?
Ooh, I don't.
For which program?
For kinship specific, I think we do actually.
I
Do we?
would like to see those numbers.
Yeah, we'll take a look at that, see what we have for you.
Thank you.
And why, not specifically, but groups of why.
Yeah.
So some of the categories for denial could be, criminal record that, certainly doesn't mean you can't care for people, but the state has put down certain
Depends on what it
criteria.
is.
That's probably the biggest trip up. The light Clinton legislation has loosened some of those regulations. So we'll share that with the committee and you also to show you what that looks like.
Next up is our medical examiner. So that, again, I think that one's a little self-explanatory. I'm not gonna go into too much, other than we do have, we had, 1,481 deaths reported, complete deaths completed in 2024, and deaths reported is 1,539. And if you remember during my dashboard, we talked about why is the report number bigger than
Right.
the death number? And that's, mostly due to carryover from deaths that occurred previously, but you complete the report in 2024.
So they were in 2023, they carry over.
Technically, yes,
Okay,
but they're counted as 2024,
okay.
and that's been rolling for years that way.
All right, thank you. Yes, Supervisor Brown.
The toxicity deaths, are those completed? Or is all?
I don't think,
I think there was one or
one,
two.
I think, yeah, there's one or two pending.
Thank you.
It's down.
Which is a
That's, I was
significant.
gonna say that's down the line.
But very close to. All right, next up is public health. So we talk about our public health services and an overview. We have communicable diseases where we handled 5,815 reportable disease investigations, 3,000 of which were confirmed cases from various different things. But it did not include COVID-19, influenza, or RSV. So,
What were the diseases?
Tuberculosis.
yep. One of, yes.
So how does that work? Reportable disease investigation? You just get, someone calls you up and
So
says,
generally, there's mandated reporters that have to report that to public health. So if you go to your doctor and let's say you have diagnosed with meningitis, that has to get returned into public health. Public health is charged to do that investigation to see how many people did you have contact with?
Okay.
Letting folks know that. So yeah, it's a whole process. For TB, some of it's monitoring compliance with medication, going to the home, making sure the person's taking it. And if you need to, you can say you're not leaving your house. So there's a lot of rules and regulations surrounding it.
have there been any reported measles outbreaks?
Not yet.
Not yet. I had my shot already. I had a new booster before I went traveling. Yes.
So outside of meningitis and TB, what are some other reportable diseases?
I knew you were gonna ask that.
I knew it too.
Whooping cough, would that be one of them?
I think it would be a lot of the childhood illnesses that we think about, like chicken pox, whooping cough. I mean, those are very communicable.
Yeah.
We also weirdly got a referral a couple of weeks ago for like a possible anthrax case that had to be, it ended up not being, but we still have to treat it like it's a community.
Yeah, so even though it's reportable, not necessarily
Right.
confirmed.
Correct.
Got it.
Correct.
Right.
All right. But the confirmed ones were 3,232 and
We can probably break out which type of.
it'd be interesting to see what they are.
Yeah.
Because
The vast majority.
Their report might have done that.
No.
Say it, it,
It's not, I mean.
surprised previous committees haven't asked about it. You guys don't already do it, and just present it or whatever. Yeah.
Is where
I
you have to
understand.
go to each person's house every day and watch them take their medicine and double check what's happening. So that takes a ton of time. And they're supposed to be at home and, and so that takes a lot of time and a lot of manpower. And so, yeah.
Okay, thank you. Yeah.
Absolutely. Asthma Safe Homes, we had 192 referred and 134 clients who enrolled in our Asthma Safe Homes program. Our substance use prevention team has distributed 2,983 Narcan kits and trained 1,502 people on using Narcan.
So,
Go ahead.
where are these Narcan kits being distributed?
So they take them to events. We have a vending machine at the job center. There's a vending machine.
At the county center.
Yeah, uptown and KCC.
Thank you.
Mhm. Then we get into the clinical care section. And this team provides preventative health services. So here you'll see TB screenings, lead screenings, urine specimens collected, things like that. Our school nurse program served 14,251 students, which equates to one school nurse for every 1,425 students. So, and then our maternal health program, we serve 51 clients, and our Bright Family Beginnings, which a lot of times you'll hear referred to as the nurse home visiting program. They do a lot of our services, completed 2,446 visits, and educational events, served 238 families. Then we move on to our environmental team, which conducts a lot of inspections and make sure that businesses are in good operating standards within the health code. 1,558 business inspections were completed, and routine inspections are things that are mandated through contracting, so a little different than the business ones. So. And then we have our lead hazard reduction program, or our HUD program. We have our lab services and a lot of more testing, things like that. Water samples tested for various things, testing for bacteria and E. coli, lots of different things that they continue to look for. Processed 409 blood alcohol tests and tested controlled substances 51. And that is the end of the public health overview. They have so much data. So go to their annual report.
Yeah, Supervisor Poole.
Yeah, the controlled substances tested there, is that using the spectrophotometer that we bought?
Probably not.
I don't think it is.
Yeah.
It's not.
Takes a while to set it
I
up.
was gonna say,
Yes.
just the
So it's going through all of its process.
Processes and training now, not actually running through that.
How long is it
It's
normally?
not turbo clearance, it's about the floor model, the
I
floor.
think they yeah.
I mean, to get it calibrated and stuff, it'll usually take like a couple months, but like you have to get the technicians and they're like.
Trained and certified
And, yes.
Do we have two? I feel like we.
Just have one.
We just bought the one.
I'm sending samples out.
Then we had to order the one, get the one, and then we had to update it. And so we had something that tested, update and like make sure it's all accurate. The one that we had to send out anything that was going to court for drugs. And so that was a 1 year turnaround time.
Yeah. I just feel like it's been a really long time since Mark
Milton.
was here and told us, I mean.
When you're in a lab, it just takes a really long time to set those things up because there's like so few people who are qualified to like come in, and if anything breaks, it takes forever. Like if you're in a university, it takes that long. It
was last fall.
And we just hired a new lab director that started this year, so she's also getting up to speed on all that. Checking all the boxes there, so it'll be soon.
Do we have any, year-end budgetary numbers for 2024? Is that something that could be sent?
For,
Just the budgetary numbers for human services, like your year-end numbers?
sure,
Yeah, is that something the committee could look at?
sure.
Just in advance, because obviously, we're gonna get it in a couple months, I know, and it'll have us, it'll mention that, but I mean, if you have it and it's available, can you just send us like a one-page
Overview.
overview of the year-end numbers for 2024, so we have something to compare?
Yeah, we can do that.
I'd like to ask Stephanie, go back to the spectrometer, is that what it is?
Yeah.
So do they have standards that they use to qualify prior to running it? Or they just qualify the entire machinery for an amount of different specific drugs they're looking for, and then they have to qualify by going to a qualified lab to have it,
Yeah, I mean, it varies depending on what you're testing for, but yeah, usually you'll have standards and you'll, like recalibrate the
Yeah.
instrument between.
With the
uses,
standards,
but to
right.
get it- But to get it up and running initially,
Okay.
like the technicians have to, everything has to be set up in a very particular way.
Mhm.
And usually, at least in my experience, the thing that takes a long time is that, how many people are ordering these things. They don't have like someone to just on call to come at any
Right.
given moment. So it just takes a while to
So
get.
sometimes you just have to get in line and then they
Yeah,
get there.
so like, yeah.
And hopefully they don't get stuck on something and then they come back and you're
Yeah,
another.
it's not like an HVAC
Yeah.
person who everyone has, so there's like a bunch of them at the ready. It
Yeah.
just like takes a while to get serviced.
We can send an email out to the group just to kind of give an update, this is where it's at.
On the machine, you mean?
Yeah.
Yeah, that's good. Roger, cool.
I'd like to have a tour of the spectro.
Yeah, I did do that last year. It was very interesting. It's a neat piece of machinery. Don't ask me to explain it. It looked cool to me, but, yeah.
But doesn't have to be isolated.
I
in some,
did,
like, clean environment
last
or anything
year
like that, because it's all
I remember when-
self.
It's more like the chemicals could contaminate you, but it's not like bio.
Yeah, well, no, I just meant to contaminate it.
We don't have it and it's still not up and running and now it's.
Or maybe it was the old one?
Yeah, Pro E and an LCMS.
Yeah, the Pro E and the LCMS.
The Pro E is the piece of machinery we had that did the testing, but it didn't do confirmation.
Yeah, my
The
bad.
LCMS is the confirmation.
Okay.
Yeah.
And
I
yes,
saw
we have
a
the
very
LCMS.
interesting piece of machinery. but I'm not sure exactly which one it was, but
They probably all look kind of the same, but.
yeah.
The one's very big.
Yeah, Lori
LCMS
was-
is big.
Take me through and, was that when you and I walked through?
Yeah.
That's right. That's what it was. When we walked through and Lori, we went into her area there. Yeah.
And if anyone ever wants to tour the lab, just give us a call. We'd be happy.
Yeah.
to have you walk through it.
Okay, any other questions? Are we?
We're not done with veteran services.
I got one more division.
Oh, I thought we were doing, sorry.
One more division. I almost done. So veteran two, sorry.
No, it's okay.
10 minutes.
Veteran
Time.
Services, phone calls, handled through Veteran Services with 13,294, visits, in-person visits, 1,838, many of which are walk-ins, some are scheduled, and we are collecting more data now. So go to the Veterans page and look at their dashboard. It's beautiful. Questions on Veteran Services? Workforce development overview, workforce development took in 206,105 calls. General reception, handled 48,000, transactions. Then, we also have our economic support, which, we have food share recipients. There's a monthly average because this is definitely a duplication month over month over month. So our monthly average of food share recipients, in Kenosha were 21,536, and Medicaid recipients, same idea. You have a lot of the same people cross over month to month. So it's a monthly average of 38,146 people. Lastly, we talk about our child support services. We collected $31 million in child support collections. They attended 3,717 hearings. And then we have our Southeast Wisconsin Workforce Development Board, which is a regional board that is trying to operate, again, a one-stop center for services for employers, job seekers, things like this. And we have some goals that our region, which is comprised of Kenosha, Racine, and Walworth. We have some goals that we achieve in different buckets. We have adult bucket, the dislocated worker, and then our youth bucket. We have our actual level, which is the things that we actually achieved in 2024. The goal is 90% of our negotiated levels with the state. So the state gives us certain thresholds that we have to meet and then tells us you can negotiate that rate. And then lastly, they set a goal of 90% of the negotiated rate is what our goal, our target goal is. So we've achieved higher than our goal in many of our categories. So that's the Human Services Annual Report.
Any other questions? Well, thank you very much.
Thank you.
Very informative presentation. Appreciate it. Okay, I think we're done. Do I have a motion to adjourn? Don't all jump at once.
We have to sign our-
Are we gonna? Who's gonna take credit for that motion?
Oh, yeah.
Yes, that's right. Yeah.
Yeah.
Would you like to adjourn?
Yes.
All right, all those in favor, say aye.
Aye.
Opposed? All right, we are adjourned.